McDonough, who is working tirelessly to build and restore trust in the VA. As you all know, Secretary McDonough served as White House Chief of Staff in the Obama-Biden administration for 4 years. He also served in several roles on the National Security Council, including as Principal Deputy National Security Advisor. Throughout his service at the White House, Secretary McDonough helped lead the Obama-Biden administration's work on behalf of military families and veterans. He has a busy schedule, as all of our cabinet members do, but he has kindly agreed to also take a couple of questions after he speaks, and I will, as always, be the bad cop. Come on
up. Jen, thanks so much. It's a total joy to be working with you, as it always is. And good afternoon to everybody here. It's nice to see some old friendly faces. I want to obviously thank Jen for inviting me today to speak about the importance of the American Rescue Plan, particularly as it relates to its support to the VA to provide quality care to our veterans, especially during the very challenging pandemic. Like other hardworking Americans, veterans have been severely impacted by the coronavirus pandemic. Countless veterans have lost jobs, closed businesses, homeschooled their own children, and faced uncertain prospects while our nation grappled with the pandemic. And like the rest of the country, many veterans were directly affected by the deadly virus, with more than 230,000 veterans in our care infected by it, and sadly, 10,605 dying from the disease. At the VA, we've risen to the challenge of combating this deadly pandemic. Our integrated healthcare system, the largest in the nation, has been running nonstop since the start of the pandemic to provide much-needed care to infected veterans and vaccines to those most at risk. To date, more than 1.4 million veterans have been vaccinated, with more than half of them having gotten both vaccines. And we're making sure that equity is at the forefront of where and how we distribute vaccines. At the same time, we continue to deliver routine care while mitigating the spread of infection. VA is leading the country in standardizing the use of telehealth for routine doctor visits. We're partnering with community and service organizations so that vets do not forego checkups because of broadband limitations. Last year, for example, in March, VA averaged approximately 2,500 telehealth visits a day. Last month, February, we averaged nearly 45,000 such visits a day. As you can see, this is a major increase, and we need the funding in the ERP to sustain this op-tempo for our veterans so we can continue to push through the pandemic. Lastly, before getting into a little bit more detail on the health situation, the Veterans Benefits Administration continues to help veterans cope with the economic impact of the pandemic, from helping veterans avoid eviction and foreclosure to making sure that veterans can continue to rely on their GI Bill to pay for tuition. We make sure that VA can continue to adapt to these challenging times, and the President's American Rescue Plan will do just that. It will provide $17 billion in additional funding to VA, to include at least $13.5 billion to improve our ability to provide medical service to veterans affected by COVID, $272 million to cut through the backlog of disability claims, and help us manage the compensation exams that have access to which have worsened as a result of the pandemic, and $386 million to develop a rapid retraining program for veterans unemployed as a result of the pandemic. Now, let me just give you one other figure for you to consider. Since the start of the pandemic, 19 million appointments have been changed, canceled, or deferred as a result of the pandemic. 19 million. What we believe is, obviously, we've been able to compensate for those through the telehealth platforms, but not for all of them. And as a result of deferred care, which we're actually seeing across the healthcare system, not just in VA, we're going to see increased cost. And the ARP is critical to our ability to make sure that we can keep up with those demands of the increased cost. So our department remains fully committed, obviously, to fulfilling the sacred obligation that President Biden has made clear we have to those who serve in uniform. The rescue plan helps us deliver on that promise, especially in this unanticipated and significant time of crisis. We urge the Senate to pass the much-needed plan as soon as possible, and I thank you again, Jen, for the opportunity to be here with you.
All right. Go ahead, Jeff.
Secretary, can you explain how veterans should go about looking as to where to sign up for vaccination? Should they be going to the VA or should they be going to their states and localities? It's certainly been one of the trickiest parts of the vaccination process to figure out information on that.
Yeah, so I want to start by telling that I think what is a very positive story. Oftentimes you don't, at least we've not in the past been focused on good news stories about our scheduling process. Our scheduling process is actually working pretty well. And so the first answer, Jeff, is those veterans in our care, currently in the 75 and older and 65 and older, who are our particular focus at the moment, should be hearing from our schedulers. And our schedulers are in contact with them. And if you just take an example of the VA here in DC, they're moving through something on some days, something like 80 veterans vaccinated in an hour. Now, that's obviously because of the vaccinators, it's because of the pharmacists, it's because of the nurses, but it's also because of the schedulers. And they're doing an amazing bit of work. So the first thing is they should be hearing from our schedulers. The second thing is we have a bunch of information on our website at va.gov, including how to get access to opportunities. And then we're working also with VSO partners and directly with veterans through even my office, whom we're hearing from, to make sure that they have the most recent information. Are there examples of frustrations? Absolutely. But we're staying obviously on top of this, Jeff, trying to be as transparent as possible. And in the first instance, reaching veterans directly to schedule them.
Are there examples of overlap too, where veterans are maybe going to the VA, but also hearing from their local, or going to their state or local facilities as well?
Definitely. And many of our veterans are obviously, this is the beauty of the integrated system, which is we provide care across the range of services. And so many of our, the over 6 million vets who are with us, rely on us for care across the board, are very sophisticated consumers of care. But then we have up to 9 million who are enrolled in the VA system, and they have choices, and we're seeing them make choices. But again, we are trying to be as affirmative and on the front foot as we can be so that we're providing that kind of information.
What I'm getting at, and sorry to ask one more, is isn't there some inefficiency there that would be a problem? Like if veterans just knew we can get our shots from the VA, that will clear space at these other facilities for other people, and it would ideally give them priority at the VA.
Yeah, and I guess my answer isn't that there's not overlap and that there's not competition. There obviously is. But I think what we are seeing, Jeff, is that we are very efficiently moving veterans who qualify through the system, and we're hearing very positive feedback on that. There inevitably is going to be some overlap, and that's what we're trying to get ahead of with forward contacting and also providing information as clearly as we can about dates and times for vaccinations, how those clinics are going to function, but also not have it just be a jump ball, actually have it be scheduled so we can efficiently get vets through the system.
Thank you. Thank you, Mr. Secretary. Can you talk about what the biggest challenges are in getting as many veterans vaccinated as possible? And secondly, is a part of that hesitancy at all? Because I know Pentagon officials have said about a third of troops have not opted to get the vaccine.
Yeah.
So what are the challenges, and does that include hesitancy?
Well, the biggest challenge is supply, and that's why we really need the American Rescue Plan. You've heard the president say this, you've heard Jeff Zients say this, you've heard Jen say this. We have more demand right now than there is supply. And that's notwithstanding the fact that the COVID coordinator, the president, have really cranked up supply week on week, including with these several innovative actions even over the last several days. with Johnson & Johnson and enhancing the manufacturing capacity. So the big challenge for us is supply. From what I hear from our docs is from the moment we get it, our allotments are in arms within 2 to 3 days. Okay, so I think that's a pretty remarkable throughput. Now, on hesitancy, you know, our lead doc on this testified last week to Congress that, in fact, we're surprised that hesitancy is less than we feared. Now, that doesn't mean that we're not going to confront it. But right now, we're seeing significant demand, that demand outstripping supply, and that demand consistent across categories. In fact, our performance among Black vets, Latino vets, and white vets is pretty consistent, if not outperforming in Black and Latino vets, white vets uptake. Nevertheless, this is going to be a problem going forward, so we're working very closely with our VSOs, very closely with Congress, and then very closely to tell the story of the more than 1.4 million vets who have gotten vaccinated to date. We're talking about what that experience has been, which is overwhelmingly positive. But we need the funding from ARP to get this done.
Follow on the supply, is there a set amount that you're getting every week from the administration, and have you asked Jeff Zients to increase that?
There is a process, well-established process that's run through the interagency. So we get our allotment every week out of that process. We then channel it out to what we call our VISNs, which are our regional setups across the country, based on their population of the target populations. So we have a very straightforward, transparent process by which we get our allotment and dish it out. Now, I think the question over time is, we're trying to demonstrate at VA that we're very efficient at moving it through, in the hopes that as there's extra, that it comes our way. So, for example, about 3 weeks ago, there's 200,000 doses. That was additive to our allotment, and we, as with everything else we're getting, we move that quickly through the system into vets' arms on a very clear, efficient process.
Thank you.
On another topic, as the Capitol's on alert today, I wanted to ask you about the veterans who played a role in the January 6th attack. We've seen 30-plus veterans be arrested for participating. We see these militia groups that are actively trying to recruit veterans. What, if anything, can the VA do? Are you considering doing to try and combat some of this?
Yeah, so I also, just to fill out the story, I also saw veterans on that day, including members of Congress who were veterans doing remarkable things, including members of the DCPD and the Capitol PD, veterans doing remarkable things. And so I think it's a full picture there that underscores that basically veterans continue to play a critical role in the country even after they retire from active duty, and we're very proud of that. As to the questions you raise, we'll take a look at that. We don't have anything specific to announce now, but again, I want to make sure that we have a full picture of things like remarkable members in the House. Mr. Gallego is one who comes to mind. Senator Cotton in the Senate. These people taking concrete action in support of democracy on the ground that day, they're vets too.
Phil?
Thank you, Mr. Secretary. Two, if you don't mind. The first one, COVID related. You talked about missed appointments and kind of what COVID has taken away. When it comes to suicide, what is the VA doing right now tangibly to reach out to veterans proactively, not just messaging campaigns, though I know those are important, but to proactively reach out to veterans to ensure that needs in that general area are being met?
Yeah, it's a major priority for obvious reasons, and it's heartbreaking. Any individual suicide is absolutely heartbreaking, and we're very focused on reducing these. The most important set of lessons I think we have to draw from is the availability of telehealth platform. Demand for mental health services is up. I think that's a good sign because it speaks to the fact that stigma is being reduced. However, there's still too much. And that is part of, that's the first half of the answer to your question, which is we're not just passive waiting for vets to come to us. We're also then working with our providers and with local communities to ensure that we have a good sense of at-risk vets and that we're establishing contact and ways to be in contact with them affirmatively. Lastly, Congress has given us additional authorities on this, and we're going to use them. The Hannon Act was just enacted. In fact, I was just speaking with Senator Bozeman from Arkansas about this earlier this week. He and Senator Tester spent a lot of time on this question, giving us new authority to make grants in local communities using local providers who know their communities best to ensure that we're providing assistance to those vets, at-risk vets, and making sure that we're doing things like reducing the stigma. So that's what we're doing, Phil.
And then just real quick, from a policy question, I know this came up during your confirmation hearing, but do you have a plan right now to either reverse or significantly revise the community access standards through the VA Mission Act?
I don't have a specific plan on that. I'm very in active discussion with people like Senator Moran, Senator Tester, Senator Sanders about what we're seeing. We're also beginning to get data about last fiscal year, what happened in the community. This is the data we're getting now is pre-COVID, so basically first quarter and a half of FY20. And what we're seeing there is a pretty significant uptake in the community. And so we got to, be a good partner with that, ensure that we're paying those bills on time to local providers. We're keeping vibrant networks so our people have places that they can find care. But we also have to be really careful that we're also maintaining investment in the integrated system of the VA itself. We have to recapitalize that and make sure that these institutions, many of them over 50 years old, are brought up to speed. The ARP will be important to that too. Things like new HVAC, new air control systems, zero pressure rooms, so we're not moving that virus through the hospital. Those are all things that are going to be enabled by the ARP, and that's why we really need the Senate to get this done.
All right, let's do the last question. Then we'll have to have him come back. Go ahead.
Thank you, Mr. Secretary. At the top of your remarks, you mentioned the importance of keeping veterans in their homes. The moratorium on forbearance and foreclosures, of course, was extended through June.
Yes.
Do you think it should be extended further?
Well, we'll take a look at that, and we're taking a look at a lot of those things. Incidentally and importantly, in the ARP is additional funding for homelessness programming. We know that this continues to bedevil us as a country. It's an outrage any night that any vet is homeless. We're, over the last 10 years, down 50% on those numbers, but they're creeping back up as a result of the pandemic. And 50%, while progress, is nowhere near where we need to be. So we need that funding in the ARP.
Thank you so much, Secretary McDonough.
Thank
You'll
you.
have to come back.
Yeah, thank you very much. It's great to see everybody.
All right, a couple of other things at the top.